Good morning, everyone. It's good to see you.
Good morning.
Good morning.
Hi, Kristen. It's so good to see all of you that I haven't seen in a while. This is so exciting. I'm actually gonna. Hi, Bridget. Nice to see you again. Kristen, your hair color is lovely.
Thank you.
Are you actually driving today, or are you?
Oh, I'm in my car because, because of HIPAA and protected health
Ah,
information.
sure. Yes.
Had to
Yes.
find a spot that was
It's your
secluded.
conference room.
And I share an office with one other person, so just in
Yes.
case I came out to my car.
Totally get it. Totally get it. It looks like we lost Brittany. Hopefully she'll come back.
No, I'm here. I just turned my video off.
Gotcha. Gotcha. I have it set to where it's not showing us blank screens. Hi, Alicia.
Hello, Stacy. How are you today?
I am doing great. Thank you.
Good, good.
I have to say a little shout out to Chloe as well. I haven't seen Chloe in ages, and I had a hard time finding you, girl.
I know, I feel like I hear that a lot. I kind of am off the grid a little bit online, I think.
Yeah. Um, but I have your number and your email now, so I'm pretty good at, I'm not going to say stalking. We're going to give this one more minute and then we will roll because we have 50 minutes together, which is going to fly by because I know that our esteemed panelists have a lot to say. But as people are coming in, I'm just going to wait just a minute. There we go. Hello, Cheryl. This is actually my second time today seeing Cheryl because she's supervising one of our students in practicum, and we did her final practicum visit today. So we've been in person and now we're in this space together. So good to see you in so many roles. Hi, Lisa. Looks like Brittany is here.
Hello, how are you?
Doing well, thank you. So it is 11:35. I'm going to go ahead and get us started. And I think there will be additional people probably rolling in and out as we go, which is fine. I just want to give a little overview of who's in the room. So we have some current students. We have at least one alum. We have a prospective student who's in process of applying. So I think this topic has really grabbed people's attention in a lot of different spaces, either thinking about what their career could be or thinking about what their career could be. So wherever you are in that pathway, we're all kind of thinking about this idea of where am I going from here? And what I love about social work as a profession is it gives us so many options to do so many things. And I'm just going to share real quickly, and then I'm going to turn my screen off until the very end. But many of you have seen me use this. This is something that Sage Publishing put out. What can you do with a degree in social work? And there are all these topical areas: poverty and inequality, healthcare and health challenges, substance use and addictions, veterans and military, global social work. And these small font words are all job titles. So what's incredible about social work is we have this flexibility to move from one sector to another and to span sectors, so that many of us are working in more than one of these areas, because we can't really compartmentalize people and their needs. They often, because of intersectional dynamics, have needs in many of these areas, and social workers are well equipped to meet them where they are and provide for needs in all of those areas. The other thing that we are very good at doing is interdisciplinary collaboration, and I think we'll probably hear about that today. But making referrals and coordinating services with people that work in other sectors is really one of our strengths. So social work training is generalist training. What generalist training means, and those of you who haven't graduated, this is on the final exam, so listen up. Generalist training means that social workers are prepared to work with any client population in any setting at any level, from micro, that is one-to-one, to macro, community, society, big systems kind of work. And actually, we're very flexible in that process, going where the problem actually is. And so what I've done today is invited 5 of our alumni who are working in very different areas with the same degree, the same social work degree. And I've invited them to just come and chat with you about what that work is like, and we'll save some space at the end for questions. I do want to let everybody know that I did hit the record button on this. I hope that's okay, because I had several people who weren't able to make it over the lunch hour, but wanted to be able to watch this afterwards. Is that okay with everybody? All right, so here's what I'm going to do is we're going to go one round with our 5 panelists, and I'm just going to call on you to introduce yourself and tell us what kind of social work you do and where you're doing that. And then we'll do another round of questions after that, but let's just figure out who's who. So Tiffany, let's have you go first.
Awesome. Hey guys, Tiffany Cole Hall. And I was going to double check before, when did I graduate, Stace? I got my master's at Spalding in 05. I believe that's right. Best class ever, right? So I think everybody says that. So I work today at the Morton Center. I'm a clinical director at the Morton Center, which is an outpatient treatment center, drug and alcohol treatment center. I'm an LCSW and LCADC.
All right, let's go to Cheryl. And I like that idea of letting us know if you have letters after your name. Everybody will have a BSSW or an MSW, but some of you are licensed. So if you want to let us know that or have different certifications. Tiffany, did you mention CADC?
Yeah, LCADC. Yeah, that's right.
LCADC, right. And you want to tell us what that means?
Yes, good question. Licensed drug and alcohol, licensed certification drug and alcohol counselor. So licensed certified drug and alcohol counselor.
Okay, so you're doing mainly mental health and addiction counseling kind of work. All right, let's go to Cheryl.
Hi, my name is Cheryl Day. I graduated from Spalding in 2018 with my master's, and I am currently a family resource coordinator within Jefferson County Public Schools. Currently working at Rutherford Elementary School. I think it's also important that before here, I was a contracted social worker where I did some work out in the community, working with adults with intellectual delays.
Thank you. Nice point there about being able to transition between sectors and really have a fresh start in something entirely new. How about Kristen?
Hi, I'm Kristen Guerin. I graduated in 2021. I worked at Norton's Women's and Children's Hospital as a case management assistant. Then I worked at U of L Jewish Hospital, also as a case management assistant. I don't have any credentials currently. I'm working for University of Louisville Physicians at Cardinal Station.
Excellent. Thank you. How about Alicia?
Okay, hello, I'm Alicia Mosley, and I operate a private practice. So I'm doing it outpatient, traditional outpatient at the micro level. We also offer case management services. I have my LCSW and LCADC as well.
Alicia, therefore, is a small business owner and an entrepreneur. Okay, how about Chloe?
Hey, I'm Chloe Scorgia. I graduated from Spalding in 2022 with my bachelor's, and I work in child welfare. I'm a social service worker for the cabinet.
All right, thank you. And my colleague Tony Helm is with us today. So you want to introduce yourself?
Hi, I'm Tony Helm, and I am an assistant professor / director of practicum education at the School of Social Work. My first career was in child welfare. So Chloe, there is life at the cabinet. I did retire from the cabinet 8 years ago, and started as a frontline social service worker and advanced up to a mid-level management position. And as I said, I'm program director for practicum, and I love practicum education.
Thank you. So for those of you who aren't already students, a social work degree includes an opportunity to do 2 semesters of hands-on, in-person social work practice experience in an agency supervised by a master social worker. So I just mentioned that Cheryl is one of our supervisors for a BSSW student this year. So is Alicia, as a matter of fact. And you get 450 clock hours minimum of hands-on experience. You're getting academic credit for that. So during the 2 semesters that you're in practicum, your classes are fewer in number to create space for you to really be out in the community practicing and honing your skills. So I'm Stacy Deck. I am Director of Undergraduate Education in the School of Social Work here at Spalding University. I started my social work practice at Volunteers of America in the Family Emergency Shelter. And I started out as a direct service worker and then was promoted into managing a follow-up program for families moving out of emergency shelter and transitional housing into permanent housing in the community. After that, I worked at hospice. So I did something completely different for a while that included medical education for physicians and other healthcare professionals on the skills of being present to patients, giving bad news, assessing family needs, and just really having a good, if you will, bedside manner. I've also done work consulting with the cabinet on improving services to folks who are receiving TANF. Done some program evaluation work in the community, and now I'm here at Spalding University as an educator and a program manager. So let's go to our first question. And this is going to be tricky because we don't want to run out of time on the first question, but could you give us a little snapshot into a day in your life? What is it like to go through a typical work day, if there is one for you? And can we start with, let's go to Cheryl this time. What do you do as a school social worker?
So I don't even know where to start. I gotta have coffee. You start there. You start with your coffee or your smoothie, and I have a jam session because anytime you work with people, you have there's a possibility that you take on their stuff. So I like to start at ground zero. So I'm gonna get my favorite drink and I'm gonna play my favorite songs to get me hyped up and ready for the day, because I have about 458 faces that are gonna be looking at me first thing. And so I start my day with a greeting to my students. Way back before I got my bachelor's degree, I come from a retail background. So I like to start every day with a grand opening. So I'm smiling. Even if I don't feel like smiling, I still smile because the kids don't have to know how I feel on the inside. So I make sure that I start the day with a grand opening, welcoming them into the school. And then once they're in, I'm checking emails, making sure I didn't miss anything over the night because as the family resource coordinator in schools, we help lessen non-academic barriers. So those are our families that may have had a house fire overnight, or a family member has passed away, or those things. And those things I kind of get over throughout the night. So I'd like to check my emails and things like that once we have the students in the building. And then I just kind of go throughout my day. I was telling Stacy earlier how, in this role, we have to connect outside of the school so that we can bring the resources to the families. So I have learned to connect with our local council woman and also different municipalities to make sure that we have the resources within the school to help our students and families.
Thank you. So Cheryl is at the Family Resource Center. Sometimes you hear them referred to by acronym Frisky at Rutherford Elementary. In our middle and high schools, JCPS has youth services centers, which are kind of a mirror image of the Family Resource Centers. And those are boundary spanning kind of services that are inward facing towards students and families at the school, but also community facing and really creating those connections, which is a perfect place to put a social worker, isn't it?
It
Kristen,
is. We're very rich in culture here. So yes, it's awesome.
Kristen, what about, and you can think across your three social work positions if you want to in the health sector, or just pick one of them. What's a day in your life like?
Well, I would say if you're really interested in medical social work, you would actually have to have a master's degree if you want to be a medical social worker. There are other avenues in healthcare as far as working in the hospital. You can be a case management assistant, you can be a community health worker, patient experience. There's many different other roles you could have. As a case manager um, assistant at Norton's, I feel like they had it together pretty well. You're assisting the nurse case manager on the floor with the patients. So, a typical day is you're looking up all your patients, you're meeting with the doctors and the nurses to find out their needs. I might be sending referrals out for a patient for transportation. They may need to go home with home health. They might need medical equipment. They might need resources for food, shelter. There's all kinds of things that you do to help. Having that social work background, even though it may not be required for case management, they do want you to really have that healthcare experience. Even if you have a master's degree, they still like for you to have the experience. And that was one of the reasons why I wanted to go into being a case management assistant. Because if I wanted to go ahead and get my master's and get that social work position, then I would already have the experience needed to get the job. So that would be one thing that I would suggest is if you get your bachelor's degree and you're not really sure about wanting to be in the medical social work, is maybe kind of dabble in it and see if that's something that's right for you. And the other thing that I would say also, it's very fast paced. You're in an environment in the hospital, so you have a lot of things going on. I worked during the pandemic, so you can imagine a lot of the things that went on in our hospital at the time during COVID. There is a lot of vicarious trauma that you can take in, so you really have to be good about having self-care, because we did have a lot of people leave out for other jobs because it was a lot, even for the doctors and the nurses. So I would say if you consider medical social work, you have to really consider the other disciplines and aspects of the work that you're doing. And most of all, you have to meet the patient where they are most of the time. So I would say that's pretty much it. It's a very fast-paced, very hard, yet it's an amazing learning experience. There's so many different aspects of what you learn and you take with you as far as resources for the patients. I'm sorry, I'm taking up a lot of time. But I would say that with medical social work, it is very rewarding, but also you have to just ask yourself as a person if you would be able to be in an environment that you would see a lot of medical things.
So I'm going to point to a couple things that you said. I assume, and I know because I've watched you do your work, your assessment skills are very sharp, and your presence is very strong. And I think those are both things that are very important in medical settings. The other thing that I want to add is you've said a couple times it's a good idea to try it out. Kristen was able to try it out during her SSW degree. She did her practicum experience in a healthcare setting. And that led to staying there up until now. And so I think that was a great idea to really get some hands-on experience and see how that fit. Let's go to Alicia.
Okay. So, my day in a private practice setting is much slower paced than that, polar opposite. I've been in a medical setting. I've worked in larger community mental health organizations, Volunteers of America, 7 counties. I did in-home, I've done school-based, I've done inpatient unit, managing an inpatient unit during the pandemic as well. So going from those environments and coming to private practice, I will start by saying that my morning is very paced. There's a lot of alignment. I get to make my schedule, and so a typical day for me, my schedule is kind of Monday through Thursday as far as clinical goes and meeting with clients. I see about 5 clients a day. I have an hour gap. But I had to learn what my limits are and, how to find that balance and what schedule works for me. But in the private practice setting, you get the privilege of making those adjustments. So it hasn't always been this like paced and balanced, but I figured that out with time. And so I will see about 5 clients a day. I have an hour gap, and then on Fridays I do my administrative stuff. So I'm catching up on documentation, emails, I'm facilitating team meetings, practicum meetings, things like that. So yeah.
For those of you who have just joined us, Alicia is a small business owner. She runs a community-based mental health practice. Is that an accurate way to describe it? Yeah. Okay. How about Chloe? And Chloe works for the Department for Community-Based Services as a child protective services worker, right?
Yes. So there's not really a typical day for me, but one thing that I will say is that I only have experience in Jefferson County, and Jefferson County, because it's, I think, the largest region in the state, has very much more siloed departments than some of the other more rural counties where workers are more generalized and they'll follow a case from beginning to end. So that being said, I work in recruitment and certification, which essentially I'm the foster parents social worker during the day. So my clients are a foster home mainly. So my days look a little bit different than an investigative worker who's going out in the field every day, taking multiple reports, looking into them, or an ongoing worker who's working with biological parents to work their plans so that the children can be reunified to them. I know in those departments, the days are a little bit more, I hear they're a little bit busier out in the field all day, things like that. But in my role, I do have a little bit more, I would say, flexibility with my schedule in terms of scheduling home visits. I'm probably out in the field for about half my day doing home visits, doing home study visits, which are the long interviews with people who want to become foster parents. That takes up about half my day. The other half of my day is a lot of documentation, assessment, compiling information that I find during those home study interviews and writing them into big, long assessment documents to see if they would be an appropriate fit to be a foster parent. And so that's how I kind of break up my days. I might decide that I'm going to be in the office in the morning, doing a bunch of typing and being available by phone and email for my clients. And then maybe the afternoon, I'm going to be driving around out in the field. During the times when I'm available by phone and email, I would say most of my day is typing things, but also I will have a lot of foster parents calling me for maybe advice on if something is developmentally appropriate or how they should try to address a behavior that maybe the foster child is exhibiting. So I'm really grateful that I have pretty, I would say for my age, pretty significant experience working in roles where I've worked with children with trauma and behavior management. So I can kind of tap into a lot of that experience. Also helping foster parents understand certain decisions that are made that are in support of reunification and helping them, helping validate their feelings of some grief that they might feel when children are reunified and they leave their home, while also making sure they understand that that means the system worked. And that's a very fine balance, working with those clients, of seeing, how they're feeling and encouraging them to, keep going. And it's a very sensitive, in every area of child welfare, you're dealing with very sensitive emotions, no matter if you're working with the natural parent, the foster parent, the child. And so it's a lot of emotional sensitivity all day when you're working with these people. So it's very rewarding. It can be very, at times, hectic, stressful. You are going to hear things that you just never would have expected to hear in your whole life. But I think the people that I have met through the cabinet, my coworkers, my supervisors, have been so incredible and helped me just learn so much so quickly.
Thanks, Chloe. The theme that is starting to emerge is there's not only variety and variability between different kinds of social work practice, but even within the day of any particular social worker. Let's go to Tiffany. What's a day in your life like?
Yeah, so I didn't mention before, but as other people talked, it hit me that I probably should mention that I have also I've done a lot of my career in drug and alcohol. I spent 20 years at Volunteers of America, like two of the other people on the panel. And I spent the last 5 of that as the COO. So a lot of that in leadership. I had a pretty serious health crisis in the end of 2022 and really forced me to reprioritize how I spend my time and not spend 80 hours a week at work. So I have found a really lovely place here at the Morton Center. And so my day then and now, the one consistency is I've always tried to be very intentional to begin and end my day with the people that we serve. So at VOA, that wasn't always drug and alcohol clients. That was sometimes developmental disability clients. That was veterans. That was really where I was that day. And so I always tried to go to one of our homes and try to spend some time. So today that looks like just popping in and seeing a client that we serve here. And that might just be before session. It might be helping do supervision, do some clinical supervision. I do a lot of clinical supervision here as the clinical director, and I love that part of my job. I have a small caseload, but most of my time is spent giving support to those that do the direct work here. So that every day it includes some direct supervision, some indirect clinical supervision. It often includes being in treatment team together and talking about our clients. I do help facilitate group and things like that in the evening sometimes. As a leader, I'm also doing things like the board meeting tonight, the board retreat, right? So it could be doing that. It could be, I had a community meeting this morning that I went to represent the Morton Center in. So it could really be that as well. At the end of the day, the thing I love to do the most is spending time with the clients and spending time supporting those that are giving care to the client. So that's something I really get to do in this role today, and I love it.
So you just further prove my point. Lots of variety within the day.
Lots of variety.
And I suspect that is one of the things that people like about their jobs. So we're going to go to the next round of questions is about what do you like and what do you not like about your work is the theme. I'm going to frame it this way because we are at the halfway point of our time together. So each person is going to get 3 sentences. We're going to take a strengths focus. I'm going to ask you in 2 sentences to name 2 things that you like about the work that you do. And then in 1 sentence, I'm going to reframe it and say, what is one thing that is challenging about the work that you do? So you get 3 sentences, 2 things that you like, 1 thing that is challenging. Notice how I did that balance there? That's a social worker thing. Let's start with Kristen.
Well, the 2 things that I love, actually, I always love a challenge. I'm a learner, so if there is a patient that needs services or a difficult case, I love having that challenge to be able to help the patient. The one thing that I don't like about the job is, basically I'm the unofficial social worker on the floor. So I am doing the social work job without the pay. So I think that was one of the things that, one of the reasons why I'm going back to get my master's, actually. So that's how I would.
So Kristen has applied and has been admitted for our fall 2024 cohort, our MSW program. So let's get the letters behind your name so you can have that job title. Okay, let's do Alicia. 2 things that you like, 1 thing that's challenging in any order.
Okay. All right, 2 things that I like. I like being a part of so many different people's lives in a very intimate, impactful way. That's part of I've learned with time throughout my career, and I'm young, so it's just starting. I just graduated in 2016, but so far I have learned that this is part of my purpose, and so I love being able to be in alignment with that. And then the other thing that I love is in the entrepreneurship side of things, I have had the opportunity to kind of cultivate the culture in my organization, and that's very special to me. Sometimes you don't always get that opportunity in larger organizations. Sometimes it can be hit or miss. Sometimes you join organizations and it's great, it's a good fit, and other times it can be the opposite. So I love that part. Sorry, this is way more than 2 sentences. Okay, and then the piece that is challenging would be finding balance, just maintaining that balance, maintaining self-care. I have definitely hit a burnout period in private practice, especially post-pandemic. So being able to step back and find that balance between input and output, that can be very challenging, but it's part of it. So
yeah. it's a lifelong thing that you have to really attend to and practice self-care. Chloe.
So I think the thing that I love most about this job is really all of the different people and types of people that I get to meet and work with on a day-to-day. Obviously, I said earlier, I love my coworkers, my supervisors, but also getting to work with relatives who take in their children and their family and watching them take on that role, and people who I see them grow as foster parents and advocates for children, and getting to watch so much growth and resilience and just meeting so many of the coolest people in our community, as well as when I've been in roles like investigating, being able to work with those families as well who are kind of on the other side of the work that I do, and watching families strengthen, watching parents gain confidence in their own skills. It's just so cool. I love people. So that was like one long, really run-on sentence. So I'll count that as two. And then the thing that has challenged me the most, I think, is the level of need that our community has. Sometimes as a result, I am asked to do a lot of tasks that are not in really my realm of expertise sometimes. So I have had to step up and learn new things really, really quickly, like how to finalize adoption so that we don't have kids sitting because we don't have enough adoption workers. That's a very new, heavy skill to learning how to do investigations because we didn't have enough investigative workers and those kinds of things, which ultimately is good because it builds your skill set, but that can be stressful because it just builds onto your caseload.
Sure. Thank you. Tiffany.
So I love being able to be a small part of someone changing the trajectory of their family's life and their life. I just, even being a small part of that, I think is huge. I love being able to, as a leader, having an impact on changing the systems, even if that's just at a meso level, right? As an agency level, being able to change systems, policies, processes that really help them change and help it easier for them to navigate. And then just the most challenging, I think, is losing people to this, losing clients and losing people to the disease of addiction.
Yeah. Keeping it real. Cheryl, about you.
The most rewarding is being able to do all levels of social work in one job. I work with the individuals, I work with the families, and working with municipalities and things like that to help change the trajectory of some of these policies that affect the unspoken. So Rutherford is, I'm sorry, and this is longer than two sentences as well, but Rutherford is in South Louisville, so it's in a melting pot. So at our school, we speak about 40 different languages. We have high immigrant and refugee families, and a lot of times things are happening and they just have no clue. So the most rewarding part is being able to invite those families into the school, and being able to increase their access, to where it's not overwhelming and it's in a familiar place. So those two things are very rewarding, and I take pride in working at this school. The most challenging, I'm going to piggyback on what Chloe was saying, is just, with the shortages, they are real. So if you know any teachers, please send them my way. And so with not having enough adult bodies in the building, a lot of times I'm asked to do things that are outside my role. So I have found that I need to advocate for myself, in a capacity that I've never had to do in any other role, to actually have the courage to tell my boss, no, I can't do something. And it's not because I don't feel like it or I feel like it's not my job. It goes back to making sure that we have good self-care in work too. So we have tasks that, we have to get done, and then we have those other tasks as assigned. And sometimes those kind of get away from us. So just making sure that, we're tapping into ourselves and know that no is a complete sentence. So,
Yeah, self-advocacy as well as advocacy for our clients and communities is super important. I want to, kind of go back to, as you all were introducing yourselves and talking about the flow of your day. Many of you spoke of either starting or ending or, at some point, doing something that is centering and connecting and fills you. And that's super important in social work practice. So it's really cool to hear that across people, many of you saying the same things. There are downsides to every job. But social workers are trained to be resilient and to find strategies to help you to cope with that and actually to thrive in those kind of settings. The next question is career paths and job prospects. And I'm going to show you one slide and then I'll unshare my screen again. But there's very good news right now. Let me make this a little bigger. So I picked the 3 sectors that or 5 sectors essentially that we're focused on today. And what I want to point to is this line right here. Look at the job growth that is projected. And I believe for social work overall right now, it's about 7% over a 10-year period. That means that if you're starting school now, there are going to be jobs. If you are currently employed as a social worker, there are going to be opportunities for employment. The other thing that is surprising to, I think, the public is look at these median salaries. And I think this, I want to say, I encourage you to consider a master's degree as a part of your education pathway, because that will really increase your earnings potential, as will adding a clinical license if you're interested in doing that direct practice or group kind of work. But all of these areas have, benefits that are clear and strong, job possibilities, and an income that you can live on. And so that is the good news. You notice that in some areas, and I want to point to healthcare in particular, because you're a part of a salary administration plan that includes other healthcare professionals, including physicians. There is sometimes an opportunity, it was my experience at hospice, that there was an opportunity for social workers to earn more. But honestly, that those opportunities are in all areas. We want to talk a little bit about the education pathway and licensing and certification. I know that some of you are licensed and others are not. Some of you have added certifications beyond your social work degree. So we talked at the beginning about how social work is a generalist degree, which prepares you to work with any client population in any setting at any level from micro to macro. I think another theme that's emerged as we've talked today is how many people are really very flexible in working with individuals, families, groups, communities, and large systems. And social workers are kind of unique in that we're trained and very intentional about doing that. So people say, well, what do I want to do if I want to specialize? Your first opportunity to develop a specialization is in your practicum choice. So you'd be working with Tony Helm, our practicum director, to pick a practicum opportunity that either is something you already know you want to do and you're going to love, or in my case, my second practicum was at hospice, and I did it because I thought I probably wouldn't want to work there, but I wasn't sure, and I fell in love. So it is also a nice way to rule in and rule out things. And then another way of specializing is through the licensure and certification process. So instead of calling on people, just going to open this up. If you have a license or a certification, can you share with us what it was like to attain that? Tiffany, I'm looking at you.
Yeah, I'll let Alicia go first because hers was more recent. I have to really think back about mine.
Okay, Alicia.
That's the same thing I was thinking of. So, all right. So as soon as I graduated with my master's, I went ahead and tested for the C. I just wanted to the information was very fresh, and so I wanted to take advantage of that.
And I'm going to say when she says C, she's referring to the CSW, which is Certified Social Worker. I probably should have done this first. Let me interrupt you for just a second. In Kentucky and Indiana, there is social work licensure at the undergraduate, graduate, and clinical postgraduate levels. So in Kentucky, it's the LSW, or Licensed Social Worker, for someone with a bachelor's degree, the CSW, or Certified Social Worker, for someone with a master's degree, and then the LCSW, which is a licensed clinical social worker, for someone with a master's degree and supervised clinical experience. All right, back to you, Alicia.
Okay. All right. So CSW, yes, got that out of the way as quick as possible. And then that opens so many other doors, employment opportunities up for you at the master's level. And then I left Volunteers of America and I obtained all of my supervision for my LCSW and eventually LCADC at 7 counties, and they offered supervision. And then I was also able to transition from different departments and get a lot of diverse experience. And luckily there were supervisors available in all those different sectors. So that really worked out for me. They covered the expenses. I had phenomenal supervision experiences. And then I was able to, well, with the LCADC, that process is a little different. You can start with your temporary, your TCADC, and then if you have a master's, you can test for your LCADC. So
these are alcohol and drug counseling certification levels.
yes, yeah, 2 different boards, so specializing with substance use and addiction. So yeah, did I answer
Tiffany, you want to add anything else?
Yeah, that's good. I'll just piggyback.
Okay.
It makes it easy for me. So I also got my CSW right after finishing my graduate work. And then I got all my clinical hours. And then I, at that point, was maybe a vice president and was kind of like, I'm not going to get my L. And this was, again, a long time ago. And so it was really before what I like to say now, LCSWs are a lot sexier than they used to be. So having your license Medicaid expansion in Kentucky wasn't nearly as big of a deal. So I honestly did not think I would use my L. I always thought I'd be in administration and leadership. I had a supervisor at the time that was like, yeah, that's cute. Go ahead and get your L. Let's do it. And I had my clinical hours for years at that point. So I guess about 11 years ago, finally took the LCSW and I'm so glad, right? Because I mean, when I did leave VOA, that's what I used to make a living until I figured out what my next step was. I was a therapist and just did private practice for a while. Worked on a few different virtual platforms. And then I grandfathered into my LCSW. So, my LCADC. I had a CADC several years ago. And then for people that had it at a certain point, they could grandfather. But the process now, kind of like Alicia talked about, is, you go and work for a place, you start to get the hours. You go through a process to get like an LCDCA, which is just an application, and then you can start counting your hours toward it. Or you could get your TCADC. We help people here at the Morton Center their first 6 months. Usually we get the application done and go ahead and start getting their hours in. And a lot of times they're able to get it in their first year here, their LCADC. And that is they can individually bill under them. And for here, it increases their salary quite a bit.
That's great. Let's add a little bit of information here. A lot of people don't realize that social workers can be therapists. They can be clinicians. They can open a private practice. The pathway for that is to get your LCSW, your licensed clinical social work licensure. And that means you can bill Medicare, Medicaid, private insurance. You can work for a place like 7 counties and they can bill for your services with the Morton Center. You can open a private practice like Alicia has done and bill for those services. So it is actually, of all the mental health professions, it is the quickest pathway to being able to diagnose and provide mental health treatment. Chloe, you're certified as a child welfare.
Yeah, I did at the time it was called the Public Child Welfare Certification Program. I think it's called CW Prep now, but you are able to learn so much while you're still in school earning your degree about child welfare. You do your practicum with the cabinet, you take some extra training and courses, and essentially how I would describe it is when you start with the cabinet, it used to be called like the academy. It's not called that anymore. It's just like the onboarding training, but you get to start that while you're still in school, and it prepares you so well. I feel like if I hadn't gone through that process prior to starting in this role. I mean, I've seen it with other social workers who started around the same time I did. I feel like my ability to take cases on at the pace that they were wanting us to I was just better prepared to have these higher caseloads than I think some people were kind of a little bit shell shocked. So definitely participating in that program and doing that was super helpful.
So CW Prep, Child Welfare Prep, is a child welfare certification program that you complete while you're working on your BSSW or your BS in social work degree. Tony, real quick, just dot points. There are some real financial benefits to being in the CW Prep process.
There are some great financial benefits. So as part of the CW Prep program, if you're accepted into that, the state will pay a large portion of your tuition here at Spalding. And as Chloe said, you complete a lot of the trainings up front. They also provide a little stipend up front for you for books or other related items per semester. And then they also have what I call a double dip now. The state has started or restarted their co-op intern program. So if you're in the CW Prep program, you get all of those benefits, the tuition and the stipend. But then you can also work more than your 16 practicum hours, and the state pays you $15 an hour as a BSW and $17 an hour for an MSW student. And so those are a few of those benefits from the CW Prep program.
So you're doing your practicum experience as a part of your BSSW degree, and the cabinet is paying you for some of that practicum experience, which is pretty cool. We also do have some other practicum opportunities, and they're very competitive because not all practicum agencies pay practicum students, but some do. Last thing I want to talk about is another way to specialize is to add a minor to your BS in social work degree. So you can add a minor in addiction studies by taking only 4 additional classes as a part of your bachelor's degree. The nice thing about that is if you're interested in that certified alcohol and drug counseling certification, your coursework during your BSSW program can provide all of the classroom hours that are required to get that certificate. And then all you need is the supervised practice experience, and you can attain that certification. We also offer a minor in health science, which is very nice if you're looking at social work and a health career. We offer a minor in psychology, also a dual degree in social work and psychology, as a matter of fact. So if you're thinking about a mental health pathway, that's a way to specialize. You can dip over and take education classes while you're at Spalding. We have an African American Studies minor. We have, oh gosh, I mean, just a communication, lots of ways that you can really customize. Your degree is going to include some general electives, which means you can pick 18 credit hours of any course you want to. If you package those 6 courses intentionally, you can leave here with a major and a minor. We have very little time left, but one of the last topics that we promised to cover was how do you get help with the cost of an undergraduate degree in social work, and CW Prep is one way. That's a nice way to get some financial support. We have partnerships with community agencies that through those partnerships, we're able to provide tuition discounts to their employees. Currently, those agencies are Home of the Innocents, Volunteers of America, Maryhurst, 7 counties, and the Center for Women and Families. And we are adding new partner agencies as we go. So that gives you a little tuition discount. We now have 5 scholarships that are solely for social work majors. So you can only apply for those if you are a social work major. We have a major donor in our community who really wants to help social work students to leave this degree without debt. And so due to his generosity or his family's generosity, we have been able to fund in past years every student who's requested some support. Spalding University also offers merit scholarships, need-based scholarships. Our Elite Scholarship is a Spalding a Spalding scholarship that is based on financial need, and we will work with you. We really look at, and we have a wonderful financial aid department. Our director of financial aid actually has a 2-time graduate of our program, and she works hard for all of our students, but she really understands the social work program very well, and I have seen her work miracles for students. We are at the end of our scheduled time, but I can stay on for a little bit if people have questions or anything else. Any closing comments from our panelists before we go? Anything we need to say?
I need to pivot to another meeting. So if there's any question, I got a couple of people had reached out and given me their email. So I'm going to reach out to them. If there's anything else for me, this has been great. Thank you all so much.
Yeah, thank you for being here, Tiffany.
Yeah.
Anybody else?
Sorry, I got to jump off too. Thank you all for the opportunity.
Yeah, thank you, Cheryl. Appreciate you being here. And I've had half of your day today. Thank you. All right. Anybody else? I noticed a couple people have been exchanging email addresses in the comments, so feel free to do that. And we will be uploading a copy of the videotape of this to YouTube and then posting it on our social media. So feel free, if you know people that wanted to attend and couldn't be here, let them know that we'll make that available. Chloe, Alicia, Tony, thank you so much for being on our panel, and to our guests, thank you for being here. We really appreciate you and hope that you got something from this. Take good care.
Thank you. Have a good day.
Goodbye, everybody.